We are excited today. I'm excited, I'll say, to introduce John Laukkanen from Healthcare Policy and Finance. John had the fortune of co-chairing the Children's Subcommittee for the Behavioral Health Task Force, along with our Executive Director from Partners for Children's Mental Health, Shannon Van Diemen. The two of them in particular led the Children's Subcommittee for over the last 12 to 14 months, I think was the process, and really led and created a great group of recommendations along with stakeholders around the state that are really specific and geared towards children. And so after today's meeting and hearing from John, we will be able to absolutely share the entire governor's blueprint that was signed off by Governor Polis in late September. And we'll also be sure to share the Children's Subcommittee recommendations. They are in their own appendix, and it's really a lot of great information and will help guide how the behavioral health system looks future forward. And so with that, John, I think I'll turn it over to you. Thanks for being here today, sir.
Absolutely. Well, thank you for having me, and please let me know if you need me to speak louder or anything like that. As Shai mentioned, I did have the privilege of co-chairing this subcommittee and did find it very meaningful work. And so I hope that today I can share a little bit of that with you, and then I'll leave some time at the end of my allotment for any questions or questions you may have. A little bit about myself. I introduced myself, I think, at the first meeting of the Children's Subcommittee as the least known person in the room. I think because I have been a licensed clinical social worker working in community mental health for 5 years before I even came to the Department of Healthcare Policy and Finance. And I was brought in to work as an integrated care specialist because I'd worked in pediatrics primary care, trying to bring behavioral health into that setting. And based on my own frustrations with the system, figured if I could get to the state, maybe I could make it better. And we'll leave the rest of that story off for another day. But around that time is when Governor Polis also took office, created the task force, and I was asked, I think primarily because I had some specific clinical and pediatric experience, to participate on the task force, and then was asked to actually co-chair. So it was a great privilege for sure. With me on that subcommittee, and for those of you who may not be familiar at all, I don't want to repeat a lot of information for those who do know about it, but there was a main task force of 25 people, which included the executive directors of many of the state departments, Department of Healthcare Policy and Finance, Department of Human Services, et cetera. And then there were 3 subcommittees. The Children's Subcommittee was one, and we had 25 people as well on our subcommittee. That subcommittee was made up of a very diverse group of folks. It included representation from community mental health providers, medical providers, Dr. Fraley from the Western Slope, if you know her, she served. So many great perspectives and voice. Brooke Greasy from, oh my goodness, now my name's blank. Sorry, I'm going to pull it up real quick here.
Judy's house.
Thank you. Wow, Judy's house. Yes. So we had some folks from the school districts. We had legislators on the group. We had folks from the disability community. And so I believe we really had an amazing diversity of perspective from both the behavioral health space as well as just Colorado. Our work ultimately was probably the most widely unrestricted, if you will. I mean, the other 2 task force actually were trying to respond to certain legislative tasks or other mandates that they were tasked to respond to. There were some consent decrees that the state of Colorado had to respond to, and so they had that task in front of them. The Children's Subcommittee, on the other hand, was pretty much given a blank slate to say, you know what, we want to hear from you to present to the governor any recommendation that you feel would make the system, and we use air quotes when we say the system because we all know we really don't have a coherent system, But whatever we have, however we can make that better, we were asked to do that. And we were asked to actually think outside the box and be pretty bold with some of our recommendations. And so there's definitely a challenge to that because there's dreaming as big as you can dream, and also knowing we have a financial constraint and we have, constitutional restrictions in the state of Colorado that are maybe unique to the state of Colorado. And so trying to balance all of that was our task. And so ultimately we adopted the systems of care framework. That was kind of our foundational document and thinking to look at a system of care and how could we look at the system, the behavioral health system in the state of Colorado through that lens, and then address the key points in a system of care framework. So we broke our work down into 6 main subject areas, and from that made some key recommendations. So our 6 main subject areas included governance, which includes everything from administration, staffing, et cetera, to quality improvement, continuous quality control, quality metrics. Finance obviously was a big piece of that, and I'll say more about that in a minute. Service array, workforce, and then access. So those were the 6 main areas. And so when you, or if you get a chance to look at the subcommittee reports, you'll see that our recommendations fall under those 6 areas. In total, we made 47 recommendations. And so when you think about the scope of this work, I'm just going to boast, we knocked it out of the park, honestly, with the amount of work we were able to accomplish, the amount of just consensus we were able to build, which is just to the credit of the folks on the group. And so I just am really, again, grateful to be a part of that. I think I want to emphasize to you, there's probably 2 or 3 main things that I think that are huge takeaways. Number one, we started our conversations talking about governance and the governance structure, size, scope, authority, et cetera. And it was the first conversation we had in our group, but it was the very last recommendation we were able to approve. And that should indicate to you how difficult that was. We had a lot of starts and stops. We had to put it on pause for a minute. We had to go back to figure out some other pieces and issues to give people even a frame of reference for what we really want to include in that governance recommendation, and then ultimately align it with the overall work of the task force itself. And so that is the one recommendation I think I am the most proud we were able to accomplish. And I would encourage you to look at it in detail. I say it's one recommendation, but it's about 1.5 pages, if not 2 pages of details about what should be in that. And to give you a little glimpse, the overall task force, the main task force, agreed that the state of Colorado should align, de-silo, bring together all of the administrative or organizational components of the behavioral health system into one administrative entity. Now, that's as clear as I can be right now because they're still trying to figure out what that actually looks like. However, what the Children's Subcommittee did was to say that whatever that looks like, when it's all said and done, it must have a distinct infrastructure for children and families. And that was really important to us because ultimately, I think we have seen, and we've seen the unfortunate consequences of having a behavioral health system that in many ways is designed for adults and that children are just tacked onto or just kind of included in as if they're mini adults. And for anyone in the kid world, you know that's not true and we should not approach it that way. And now that we have an opportunity to reform the system, we want to make sure that the system actually reflects our best thinking and our values and our priorities for children and families who have very distinct needs, very distinct solutions, and very distinct resolutions to the challenges that they face. And so that was a huge piece for us to call out and to get that included in the blueprint, that the children and families would have a distinct infrastructure within this behavioral health administration. So I encourage you to look at that further. The other piece, and again, like I said, there were 6 main areas we focused on. I will tell you that 3 of the areas we actually broke up into work groups so that people on the on the subcommittee could really engage in areas where they had expertise, and then bring those recommendations to our main subcommittee for final review, and then we passed that on to the task force itself. Those subgroups or those work groups were the workforce, service array, and access. The access group actually is the area where we tried to align the work of the subcommittee with the legislation in SB 195. And so if you are familiar with that law that was passed that pushed us in the direction to creating wraparound services for children in the state of Colorado, that law came out and the task force came out almost around the same time. And so we wanted to make sure we were aligning that work. As you may have heard, that work was defunded in our most current fiscal crisis. And so we're optimistic that we can get that back at some point in the future. But our recommendations still stand and are pretty aligned with the work and the recommendations or the legislation of 195. The financial work, that was a massive lift, I will tell you. And I do want to thank, again, publicly PCMH just for their contribution to that, and obviously Shannon Van Diemen's commitment to ensuring that we made informed decisions to the degree that we can. For those of you who work in the children's system, you realize and you know and you are frustrated by the fact that so often a service depends on who's paying for it. And what a family is eligible for is dependent on who's paying for it and where the funding stream is coming from. And the fact that we have such a convoluted financial system when it comes to behavioral health is an area that we felt needed to be addressed. And so there is a separate document, and I don't know if you can also include that link as well, Shai, when you send out resources, but that includes the review of the funding streams for children's behavioral health in the state of Colorado, and some recommendations that came out of that. But that work was pretty massive. And it tells actually a very, besides the obvious things, it actually was a very revealing effort that tells us, and I think the biggest takeaway to me was, in many ways, we don't know where the money is going. And that is very disappointing. That in many ways, there is a lot of money that is being spent that is just due to the constraints of our data systems, the fact that we have systems that don't even communicate to one another throughout the state departments, to be able to align or to account for this money in ways that is tangible and meaningful, we don't know. And so that goes into some of our quality recommendations, that we actually create an infrastructure that has data that can track, that has data that we have designed to be framed toward outcomes, and that we can actually look back and analyze in a way that can inform how we navigate the system. So when you see that document, you'll see what I'm talking about, that there's a lot of, well, what does that mean? And where's the data on that? And the fact that we can't get it is a key challenge for us. So where does this work go? Let me go there, say a little bit in that direction, and then I'll open it up for any questions you may have. All of our recommendations from the Children's Subcommittee went to the main task force. The main task force then took all of the recommendations from all 3 subcommittees, as well as some of the other specialty work groups that were created. There was a COVID work group. Obviously, COVID hit in the middle of this work. There was some other specialty type work groups like telehealth that happened out of this effort. And so all of those recommendations were brought to the main task force, and they sat down then and voted and prioritized them. So they broke these recommendations down into kind of 3 phases: phase 1, phase 2, and phase 3. And so phase 1 is actually what we're in right now. So the task force work has concluded, and now we are entering phase 1 of, if you will, maybe implementation. That may be too strong of a word, but ultimately what they elevated to the priority here of this phase is to create the behavioral health administration, to really get that component up and running. That obviously is not going to be infrastructure and buildings, brick and mortar, but the concepts, the organizational flow, and maybe where we're going. Obviously, that's going to take some time to get stood up. That was a priority. Expanding telebehavioral health was a priority in phase 1. And then obviously, I think that comes directly, we had SIM for 5 years that really focused on advancing broadband and access to telehealth, telemedicine, et cetera. And then that went away. And then we had this effort, and then COVID hit. And so clearly we have had 3 strong indicators that telehealth is a priority and is a need in the state of Colorado. And so that's a second focus. And then the third focus was to simply identify legislative opportunities and new funding sources. So that's where the effort and attention is right now. Once we can get some direction, some clear specifics on those components, and those kind of begin to move forward in physical implementation, then phase 2 is going to focus on a statewide care coordination component. That was a huge piece of the main task force work, is that idea of care coordination and ensuring that families know how to navigate a system and how to help them do that best. And then the top 19 recommendations, all of the recommendations from all subcommittees, like I said, were voted on and prioritized. And there were 19 that rose to the top among all of them. And remember, we had put forward 47 just from the Children's Subcommittee. But 19 were raised to the top, and that's what they're going to start with. And then phase 3 would be looking at the rest, all of the others, and continuing to work on the funding streams, et cetera, and to align that. So that's where this work is going. And right now, there are stakeholder engagement opportunities. If you want to be involved or participate in these presentations or ask your questions through the larger behavioral health task force, that is very much welcomed. And so I'll pause there and see if you have any questions for me.
John, thanks for all this great information and a recap. It's interesting to hear your summary, having followed this process for so long, and everything that you talked about is so in depth and really took months and months and months of bringing people together to get here. And today to kind of hear the 15-minute elevator speech, it's just like, wow, it's hard to believe that it took so long to get here, but a lot of great action. So thank you. We can definitely open it up for some questions. The floor is open.
Come on, David, you're never generally silent.
You know me too well, John. No, I mean, I think I'm so glad that you highlighted the challenges in governance structure and the need for a separate infrastructure within the sort of, I forgot what they call it, the directorate, I don't know, the new entity, whatever it will be called, that we need to have a separate infrastructure for children in the midst of that. Otherwise, as happens all the time, they'll get forgotten. How do you think did that resonate with people? Do the people who don't do kids all the time get how important that is? And is that some of the groundwork we need to be doing as we move forward, is to just make sure, because those seem to me to be the most important pieces that need to get into place as we move towards changing the system.
Excellent point, and thank you for bringing that up. And I would say, did it resonate? No, I think it really did require, even down to the last minute when we were editing the final draft, saying, hey, you didn't include this language and I want this language in there. I think a lot of times people hear kids are not small adults, right? We know that, right? We hear that. And the importance of that statement does not resonate in the Department of Insurance. Or these other administrative components where, we had a very interesting discussion in the main task force when we presented some of these conversations. And to even say that, it almost seemed like, oh, that's an odd observation. And, one of the easiest examples to illustrate to some of these folks who were sitting around that table are, how often do you engage the Department of Education in adult behavioral health? Never. And the fact that you're going to leave out the Department of Education in this organizational flowchart tells me you don't understand the primary systems that kids are engaged in, and one of the main providers of behavioral health services for children and families. And so, you know, it was an interesting conversation to really continue to drive that home. And so I would say, to your final point, yes, we need to continue to hold that up as an important message, and continue as they roll this out to be vigilant, to ensure that they heard what we recommended and that it does get implemented. I will say this on that note too, for any who are in key positions or who are engaged in giving feedback, you know, one of the things that I have even potentially advocated at HICPUF is HICPUF in and of itself doesn't have a distinct children's infrastructure per se. We have a lot of benefit managers who manage benefits for children, but as far as a leadership structure or an infrastructure that looks at the overall components of kids and families that are very different, like I said, I think one of the reasons I was even asked to serve on the subcommittee is because at HICPUF, there's not many people like me, you know, as far as either having clinical experience or having a focus specifically on kids. And so sometimes in those conversations, even at HICPUF, it's not always an obvious component to the conversation. So.
Other questions, thoughts, points for discussion? I know this group typically isn't this quiet, so you guys can't fool me.
And if things come up after the fact, by all means, you're welcome to share my email, Chai, and I'm happy to follow up or maybe even connect some dots after you've read some of the material if you haven't seen that yet.
Hi, this is Meredith Henry from Tri-County. I just wanted to speak up for a moment and really congratulate and thank John for the phenomenal work that this subcommittee has done. I've been following this work for a number of years. I'm also a former HICPUF employee. So everything you say, I'm giving you a big shout out to. It's just absolutely fantastic to hear what you've come forward with. And that's why I'm so quiet today. I'm like stunned. I'm like, wow, this is amazing. You're saying and doing so many of the right things for children and families across Colorado. So I will do whatever I can to champion so much of this work for children's behavioral health through Tri-County moving forward.
Thank you so much.
Keep up the great work. Children are not small adults, and you know their families need care too. So
thank you.
Hi, John. This is Rebecca, also from Tri-County, and a lot of my work right now is obviously responding to COVID. And I was wondering how you think the implementation of some of these recommendations is going to change in light of the stress that families and kids are facing with remote school or financial strain, and also that colliding with the financial strain on our systems as well.
Yeah, well, I will say as we're learning about COVID, I think we're learning about everything else that happens and our systems that we have in place and their maybe inability to meet the need. So I'm glad that we did a COVID subcommittee meeting that then pushed our recommendations up to the main task force COVID response. And what that really was saying, all right, looking at what COVID has done and how we have just moved to remote meetings and remote work and remote school and remote treatment, you know, what does that mean? So I think we at least, I will say, we're fortunate enough to have that lens before we wrapped up this blueprint. So I think it's not completely off the mark. I think it does incorporate some of these observations we were able to have early on in this pandemic. And And interestingly enough, I think, like I said before, I think it does just continue forward. Some of the things that the state has known for a long time, and now we just have like a critical mass to get it done. I think the one thing that's pretty obvious to me, kind of like I mentioned, specifically with school, that was one of the primary behavioral health service providers for our kids. And the fact that they're not getting that, or they're not there, or they're not having that adult support network, peer support network, that's the part that's going to be very difficult to replicate over Zoom. And that's the part that's also very difficult because many families who have, and we'll just say lower acuity levels of services, when you think of it in the context of a community mental health center, they don't want to go to a community mental health center, right? That's not the place they want to bring their kid and sit in a waiting room there, right? And so how do we almost create new things now, I think is the key. So all that to say is, we knew we had 1 year to do this, and we knew if we didn't get the governance recommendation right, we'd be doing this every 2 years, every 5 years, every new administration, come back and reevaluate what do we need now. And so I think that's why that governance recommendation is so critical. If we can get people in the right places to bring all of the right resources, the money, the data, the policies, aligned, and have a key adult and child voice and perspective there, then that could be a lot more nimble and responsive as we navigate this. And so I am thrilled that that's where we're focusing our first effort, and hoping that, all of the other community supports that exist in the world right now can help at least buffer some of what we're lacking by no school and some of these other issues.
Shai, I don't want to blow up your schedule, but John just made me think of another thing that is going to be problematic as you implement it, which is the relationship between this new entity and however it is structured, particularly around kids governance, and HCPF, which
of course you have to bring this up, David.
I do. Well,
Yes.
HCPF is the largest one.
Yeah.
I don't know if it's the largest, but it's certainly one of the largest funders of mental health services in the state. And how to align this new governance structure with HCPF structure is going to be critically important. It really calls that question that you raised, which is, so how do we get a children's directorate within HCPF to really be able to make sure that the forces are aligning between those what will be two very large organizations?
Absolutely. And so to that point, so maybe it was cosmic, or I don't know what you want to credit it to, the fact that I'm sitting on the task force, but also work for HCPF was an interesting little oops moment, because then HCPF has had internal conversations about looking at this work. Obviously, Kim sat on the task force as well, in the main task force. And then HCPF had a member on each of the subcommittees. And so that group of us then have gotten together to say internally, how can HCPF align with that work? So that is the question we're asking internally. And that's the voice and the message that I keep bringing to that conversation is, all right, we have made a strong recommendation here in the task force for a distinct children's leadership structure. And that means we need to align HCPF the same way. So Kim has verbally agreed to look at the things that we can do to transform and move HCPF in a space and a way that anticipates kind of a effective docking. If you think of a space shuttle analogy here, that these two systems do have to link. And how are we going to do that? And so there were some key recommendations, or maybe offerings, if you will, from HCPF saying, here's how we will support, here's how we'll align. And one of them was looking at a children's leadership alignment. So whether that's director level or sub-director level, et cetera, but it's in there. And so now it's really enacting it.
I have a question for you, John. Does any of this work involving children talk about how children and families could be treated and cared for differently in Ray contracts?
So short answer, no, because, and this is maybe wasn't clear in David's question, how the final thing stands right now is that HCPF is kind of outside of this behavioral health administration. And so the recommendations of the Behavioral Health Administration and this new thing is really focused on everything outside of HCPF.
Okay.
And so then that's where now HCPF now needs to take the responsibility to mirror or in some way align so that there is some ability to connect and link accordingly. So in the recommendations, the blueprint, et cetera, it's raised or not called out because that is the distinct HCPF entity thing.
No, I know it's complicated. It's complicated. And often the raise, sometimes you can see how children and families need to access behavioral health services through the raise. And that's where it happens that children are seen as small adults, and that's challenging.
Yeah, I do see that the more that the Behavioral Health Administration structure, policies, workflow become clearer, then I think HCPF will have the ability to say, okay, now here's where we need to change. And so I think as this work moves forward and this becomes clear, you'll see some changes on our side.
Okay.
Great. Yeah, thanks.
I'll be paying attention.
Please do.
Thanks, John, for being here. And I think in the interest of time, we have a lot of awesome speakers here today. And so we want to make sure we can get to everyone, but John will definitely share your contact information and really appreciate the time and for sharing all your work and sharing this great information with us. And I'm going to turn it over to Joe to introduce our next speaker.
Thanks, Rebecca. Yeah, I'm really honored to introduce Dr. Janiece Mackey, who is the co-founder and executive director of Young Aspiring Americans for Social and Political Activism. So without further ado, I'll let you take it away, Janiece. Thanks.
Thank you so much. And thank you all so much for having me. I'm really excited to be in space with you all. I have I'll call it a mini presentation that I'll be sharing. And kind of like going through quickly. So please feel free to ask any questions that you all may have as they come up. All right, just want to make sure everyone can see my screen, right? Awesome, cool. So first, just want to do a land acknowledgement. That's extremely important to me, especially on election day, right? So just want to honor that we are standing on indigenous lands of the Cheyenne, Ute, and Arapaho tribes, and many others as well. So much gratitude for being able to share this space in homage to them. What I plan to talk about is a little bit about myself. I know I'm new in this space, so I think it's important that you all know who you're listening to. I'll share about YAASPA and our work and some ways in which we've pivoted with the multi-pandemics that are happening among us in this time. So this is my family, a little bit about me. I'm from Colorado, particularly grew up in Aurora, went to private school up through 4th grade and then transitioned to public school in 5th grade. And unfortunately, I had internalized a lot of the systemic inequities in really problematic ways, quite frankly. So I was asking a lot of deficit type questions, you know, specifically to my fellow peers of color, like, why aren't you doing your homework? You know, why aren't you reading like me? All of these things, not realizing that these were systemic issues, right? And so then I ended up homeless my 6th grade year with both of my parents because it was a housing justice issue. So someone essentially came to our door and was like, this is our property, you need to leave. And so we were homeless for a few months from motels, hotels, also the Samaritan house, only because my parents were married, which is problematic as well, right? And so that shook me to my core, and I became super enamored with social justice, right, and making a change. I didn't have that language, of course, as a child, right? But I was thinking, I'm gonna be a lawyer, right, to make a change. I'm gonna be the next female Johnny Cochran in order to address these type of issues. Fast forward, went to University of Denver, which many of you are probably familiar with, which is traditionally white and upper income. And then those same deficit type questions that I was once grappling with as a young child were imposed on me. And so I was fighting for my life in the classroom in criminology and political science classes, trying to push against these deficit narratives, right, about Black and brown folks. And then when I was in civic spaces on many campaigns, right, I often was being tokenized, but not realizing it at the time. And then got pregnant with my first child my junior year. And so folks kind of in the civic engagement camp was like, that's not cute. Good luck with that. See you later. So yet again, right, it was this epiphany that this bootstrap rhetoric doesn't work. And so I graduated early, ended up in the realm of education as a bilingual counselor, and just fell in love with working with young people on the front end and seeing the power of impact there, and was like, I'm not going to be a lawyer. It's going to be too late, right? And so I remained in the nonprofit sector in education for quite some time, but was continuing to see my story through the lived experiences of the students that I was working with. And so I was like, I'm going to create something so that Black and brown students can reclaim academic, career, and civic spaces. And so that led to the birth of YAASPA in 2010, with 6 kids in the library as a pilot. And now this is our weird 10-year anniversary this year. And we work across 3 school districts, Aurora, Cherry Creek, and Denver Public Schools, with middle school through college students. So now just a little bit more about us and what we do. We have a myriad of programs. We have courses for middle and high school students so that they can get academic credit for their civic and intellectual labor, because we do a lot of work on unlearning the way systems try and socialize us, right? And we believe that they deserve to be compensated through academic credit for that. So super excited about that. We also have youth councils as well, paid internships. I don't know about y'all, but I did a ton of unpaid internships. And so we believe youth deserve to be compensated for their labor. We think it's a good lesson for them to learn early on as well, to understand their value. We also have a Social Sciences and Policy Institute, which is a summer program, a partnership with CCA to provide scholarships for students who pursue a social science degree. And then we also created a Center in Community Wellness and Resilience program this year, just with everything that had happened with COVID and the uprisings with regards to the manifestation of racism. And I'll talk a little bit more about that later. So our 4 areas of focus within YAASPA are these. So racial identity development, civic literacy, civic engagement, and racial identity development, and academic and career efficacy. So if we had more time to chop it up, I would take y'all through an activity, but a lot of what we do with YAASPA is really ensuring that youth know who they are amidst a socio-political context or positionality, right? So if you were thinking to yourself, right, I would ask you all, what are your most salient identities, and how does that inform the way that you move through our socio-political context, and even especially today, right? For me, in full transparency, my race is my most salient identity. One, because it's imposed, but also because I've embraced it as my most salient identity as well. And I choose to stand in my power and in my Blackness in everything that I do. The reason that I share this with you all is because I think that positionality work, or how we identify, informs the work we do, right? So I have to be very transparent as a co-founder of an organization that my ethos then translates into the organization's work, right? And I think it's really important for all of us to be cognizant of how our identities intersect and how it informs the way in which we engage in community. So one of the ways in which we look at doing that specifically with youth is honing in specifically on their cultural capital and honoring their cultural capital. So to resist sort of the deficit kind of questions I had as a child, right? We choose to have more of an asset-based approach. And so we honor their aspirational capital, their navigational capital, navigating systems, right? Their abilities to code switch, right? Which is often imposed. Their familial capital. So rather than, again, having this deficit notion of what family looks like or should feel like or should be like, we honor students in the way that they come to us and see that as familial capital. And also even expanding the notion of who is deemed as family as well. Social capital, so rather than simply, especially as a civic organization, right? Like, oh, who do you know that is an elected person or individual, right? It's who's your neighbor, right? And who do you know in your sphere of influence, and how can you capitalize off of that? And then my favorite is resistant capital. So once you have knowledge, how do you push on systems? How do you heal ourselves, right? So now I'm going to shift a little bit to our work for the sake of time, and just ways in which we have centered race and some of our policy work. So we put out a concurrent enrollment racial equity report in 2018, and we had 10 call to action items. And it's pretty dope that we've been able to see at the state level some of our call to action items be addressed through state policy. As was said earlier, which I really appreciate going after John, that it's one thing to pass something, right? And then it's one thing for it to actually be implemented, right? So we are steadily trying to grapple with what state policy has looked at on the ground, in the ways in which students are or are not experiencing these shifts that we called for in concurrent enrollment, which is college level classes for high school students. We had a transit equity campaign, which was launched by our students this past January, but that is on pause right now because we're remote, right? But in essence, what we were calling for is Aurora Public Schools to cover the transportation costs for students to go to their internships, as well as to Pickens, right? Or as well as to Community College of Aurora, because it's one thing, again, to offer the opportunity, but if there's barriers in getting there, right, then it's not really an opportunity. So that campaign is on hold right now, but it's definitely something we plan to pick back up. We also collaborate a ton. So shout out to Project Voice, because they are the ones that were student voice, student vote. I know they've done a ton of work on 76 this election cycle, and trying to make sure that that is cut down, because that would impact 17-year-olds being able to participate in primaries. So we also do just a ton of collaborating with our sister organizations that engage students in the Denver metro area as well. And then our youth councils, right, are really where a lot of our issue work is birthed. And so we walk students through youth participatory action research so that they are fellow research partners in this work, and they're compensated for that as well. So we've had students work on public health with regards to specifically like tobacco, companies targeting Black and Brown communities, mental health, which is huge right now and always has been, but definitely in this time as well. Some of our students are partnering with Colorado Youth Congress on an op-ed with regards to racial justice and mental health, and a call to action for educators and how they can be more responsive in that way. We also just recently had a virtual town hall regarding cops in Aurora schools. There's no issue cut right now, right? So we're not calling for them to stay in or get out. And I say that very clearly just because we want students to be the primary decision makers of whatever it is that they deem should happen based upon walking through youth participatory action research. And when we say Aurora schools, we're talking about APS as well as Cherry Creek schools as well. And if you all are interested in just hearing what the students had to say with regards to cops in Aurora schools, it is on our YouTube channel and also on our Facebook as well, if y'all want to check that out. So shifting a little bit towards like pivots and where we are headed. So obviously with the compounding issues that happened this year in Nina Pop and George Floyd and Breonna Taylor, many of our students were reaching out to us with the desire to do something, right? Many of them actually were not allowed to go to protest. And so because of that, they were feeling this urgency and paralysis around their action or inaction, right? And so based upon that, we began to have collaborative healing sessions with students and really have focused a lot of our work more so on collaborative healing spaces rather than what we call like performative civics, right? So we were getting a lot of media calls from folks like, hey, what protests are you going to? And what are students doing, right? And we honor that as a form of activism, 100%, right? But we also wanna make sure that publicly folks know that that's not the only form of activism, right, that our healing also is a form of activism as well, and a huge component of community wellness. Also, we have this value that's very important to YAASPA, which is reciprocity, right? So rather than just simply extracting, right? How can we be reciprocal in our relationships? How can we be interdependent on one another, especially in this time when we really need to be honing in on community wellness? And so with that said, we created the Centering Community Wellness and Resilience program. And so these are some of the various components of the program. Food, of course, yes, right? But I say yes, of course, kind of sarcastically, just because I also think it's a little bit short-sighted. So some of our funders, right, were like, well, how many people can you feed, right? And, oh, food doesn't cost that much. And we're like, well, people need a lot more than food and have been needing a lot more than just food in this time, right? And so with that said, we try to really think about how can we have, again, a cooperative economics model in order to center broader community wellness. And so the way we did that was partnered with Black-owned businesses in order to provide food, right? Again, thinking about that value of reciprocity and how we can create that interdependence within community in order to build community as well. We also provide coaching for students and families in partnership with Lions Educational Consulting. Some of you all may be familiar with Asia Lyons. She's a super dope woman, and she has one-on-ones with our students in order to support their mental health and their emotional health, but their academic health as well. So again, not just being deficit laden of like, oh, they need help, right? But like, what are you dreaming up in this time? What are you grappling with in this time? What does your future look like? Really honoring their futures as well in this time. We've also partnered with a licensed therapist named Jason Schenkel as well, who has conducted one-on-ones with students and families, as well as participated in our collaborative healing sessions that we host twice a month as well. So we're super excited about this program. Definitely something I wish we would have actually created even prior to this year. And so we see this continuing to be a staple within our organization and community as well. So really what we're shifting towards, right, is honing in on students' critical agency and really shifting what civics looks like and activism looks like or feels like and sounds like, and kind of pushing on kind of this either or perspective. And really looking at the nuances of activism, including healing at the center. Ways that folks can support. So this is our flyer for our collaborative healing space. We have one coming up on Friday at Endless Grind, and then we will have Jason Schenkel with us on November 20th. I will say this is a youth space, so not necessarily inviting adults, right, but inviting you all to share with students. We definitely don't necessarily want like an adult gaze, right, while youth are engaging in their collaborative healing work. And then secondarily, we are hiring for a program and talent manager. And so if any of you all know some brilliant folks who has experience managing, supervising systems and folks, that would be really awesome if you could share as well. And with that, I will close and open for questions.
I thank you for that. I do have a question. As far, you said you guys work in APS, Cherry Creek Schools, and Denver Public Schools. Are there any requirements for the clients, like as far as eligibility goes? Does it matter what their grades are, things like that?
That's a great question. Definitely doesn't matter. We don't want to have any sort of barriers in place for students to be able to be in space with us and participate in our programs. I will say it varies district to district how students get connected to us, whether it's a class or one of our other programs or youth councils, but definitely no barriers for students.
Okay, thank you. And then the referrals, do they have to come directly through the schools, or can they be outside of the schools where kids connect with you?
It's another great question as well. So both and for sure. So from community, schools, wherever.
And I'm sorry, your email address was on that last one. Would you mind typing it in the chat or just saying it out loud, whichever?
Yeah, for sure. Yeah, I'll type it in the chat for sure.
Is that the best way to get the job opportunity flyer also from you, is to email you?
Yes, please.
All right, will do. Thank you.
Right on. Thank you.
Hi, I have a question about the kind of COVID supports that you were talking about in terms of food and mental health resources. That's amazing. Part of my work right now at Tri-County is to help positive COVID cases and contacts get connected to community-based resources. So in order for folks to access those resources, again, is there inclusion criteria, or should we just share the link to your website for them? Or is it they have to be enrolled in one of your other programs?
That's a great question for our funders. No, I'm just saying, I'm just teasing. No, you can totally refer them for sure. We've expanded the program to include folks who aren't necessarily connected to YAASPA already, just because we are seeing just such a significant need. So yeah, absolutely, you can refer folks.
I have a question, and excuse the toddler jabbering in the background. So the Aurora Health Alliance so we're looking at our mission and how we can be more sensitive to and acknowledge that in our current mission statement, we have deficit language. We say vulnerable, we say underserved. Do you have any recommended ways in which, like through your conversations with kids, or ways in which organizations can begin to think about that a little bit more deeply?
Yeah, I love that question too. So I would definitely include your constituents, right? Whoever you deem as your constituents in that process for sure. And ask, how do they desire to be identified? How do they identify themselves? How do they think about their own communities? I would definitely hone in on cultural capital type language as well. It's something I grapple with too, though, right? Because there's an acknowledgement piece of saying underserved, right? So definitely, like, I'm on the learning journey with you too, because I think in our mission statement right now, it has like disengaged youth, right? And I've grappled with this a lot with our students and our board as well, and our team, like, should we take that out? Should we leave it in? And at the same time, there's this acknowledgement that there is some disengagement because obviously our systems aren't working, right? Like our civics class sucks, right? Like civic education is not so great, right? So there is this acknowledgement that we want to engage students who have typically not been engaged in these traditional systems, right? But then at the same time, wanting to honor that they actually are engaged. So it's totally a grapple for me too, but that's where I would start for sure, is including your constituents in that process and in that grappling as well.
Thank you.
Any final questions or thoughts for Janiece? We will be sure to share the slide presentation out to this group if that's okay with you as well. And your contact information will be included in the follow-up email in case anyone wasn't able to get it out of the chat. We really do appreciate your time today, and keep up the great work. And we would invite you to come back anytime you'd like to be a part of this group.
Thank you so much for having me. Thank you so much.
Great, thank you. You're welcome to stay if you have the time. No obligation though, so.
Thank you so much.
All right, I'm not sure, Joe, Rebecca, would you like to introduce our next speakers?
Sure, Shai, I'll go ahead. So I'd like to introduce Amy, Ellie, and Katie from Immunize Colorado. We invited them to join us today to talk about a couple things that are hot topics right now. One being access to the flu vaccine for children and their families, knowing, right, that respiratory illnesses are a big topic this year. It's important for people to get the flu vaccine. And then also to talk about potential planning that they're doing related to a future COVID vaccine and some community engagement work in that space. So thanks to you all for being here from Immunize Colorado, and you're welcome to share any slides if you have them.
Yeah, we do have slides, so let me pull those up. And thanks, Rebecca, for inviting us here today. We are sort of new to the group as well. I used to sit on this group a couple of years ago, and it's been a while. So great to be back. But yeah, we're just going to give an overview of some of the projects that we're working on at Immunize Colorado and how that's really changed since the COVID pandemic started. So I'll do a brief introduction and then hand it over to my wonderful colleagues to share what they're working on. So my name is Katie Waters, she, hers, and I'm the program director at Immunize Colorado. I've been here for about 4 years, and I have to say every year is exciting working in vaccines, but this is like next level. So we'll be sharing what we're working on today. And can you all see my screen okay? Okay, perfect. So just a little bit of background, Immunize Colorado was formed in 1991 by concerned physicians at Children's Hospital Colorado. We're now a separate 501c3 nonprofit, and we're formally known as the Colorado Children's Immunization Coalition. So if you've heard of that organization, CCIC, that's us now. We recently expanded our focus to be across the lifespan and beyond just childhood vaccines. So again, we're a nonprofit organization promoting community health through immunization. And just want to note here that we do not accept funding from vaccine manufacturers or distributors. So these are our key program areas, and Amy and Ellie will talk about some of the work that we're doing in these areas in a little bit. But first, we are a coalition-based organization. We have a large statewide coalition of different providers, educators, advocates, all working in the immunization space. We also work in public policy. So you might have seen in the last legislative session, there was an immunization bill that was passed. So we can talk about that in the Q&A if you have questions about that, but definitely a big project we've worked on this year. We also work to provide free and low-cost vaccines. We do community outreach and awareness. We do provider education, and recently added a new program area called data translation and action. So really localizing the immunization data that we have in Colorado to our different stakeholders. So just some level setting, I just want to point out here, of course, I think we're seeing in the COVID pandemic how closely related infectious disease is with the economy, with education. So just want to point out here that typically Colorado has had room for improvement in our vaccination rates. And here are just some key stats here that in 2018, over 10,000 children were hospitalized or went to an emergency room with a vaccine preventable disease. And we also see that we have sort of an issue around school required vaccines as well. For instance, in the previous school year, we found that almost 50,000 students could be excluded in Colorado for either not having, in the case of a measles outbreak, that is, for either not having a vaccine record on file or having an exemption to the vaccine. So still a lot of work to do in Colorado. And of course, that's just further impacted by the pandemic. As we all know, access to healthcare has really been impacted by the pandemic, especially preventative healthcare, especially in the beginning when we had the stay-at-home orders. Families, parents were just not going into their pediatricians and provider offices like they were before the pandemic. Specifically in Colorado, we know that childhood vaccination rates decreased an average of 19%. Sometimes it was up to 40% because of the pandemic. So even though we had low rates to start with, the COVID-19 pandemic has really further escalated this issue. And we know that our communities are now even more at risk of additional outbreaks of infectious disease beyond COVID-19. So this map just shows the variability of our immunization rates. I think like we've seen with COVID, infectious disease can be a very localized issue and really depends on the different policies and programs that are available at the local level. So this is a school district map of MMR rate, so the measles, mumps, rubella vaccine. And really our work at Immunize Colorado, although we're a statewide coalition, we really work to support our partners at the local level to address their specific community needs and community issues around vaccine access and vaccine education. So that really led us to this year becoming a first-time AmeriCorps Vista sponsoring organization. So we now have 8 full-time national service members across the state of Colorado, mostly working at local public health agencies. And then we have Amy and Ellie with us here today who work in the Immunize Colorado office. And they're really working, especially right now as local public health agencies are responding to the pandemic, really looking to provide that capacity building at the local level to make sure that our communities still have that access to immunizations during the pandemic. So again, just applying those local approaches to local concerns. So now I will turn it over to 2 of our AmeriCorps Vista members to talk about the work that they're doing.
Hi everyone, my name is Ellie Delay. As Katie mentioned, I started as AmeriCorps Vista with Immunize Colorado back in July. And so for the first couple months of my Vista position, I really focused on looking at that immunization data for Denver, Adams, Arapahoe, Douglas, and Jefferson counties to really get a better understanding of the community and what we need to do in this community to improve immunization rates. So if we take a deeper look at Aurora, we see that immunization rates are quite high. In the Adams Arapahoe School District, we see that 94% to 96% of students are fully immunized, depending on each vaccine. However, there's always room for improvement. For example, depending on the vaccine, between 659 and 1,025 students in the school district have that incomplete or missing record. So as Katie mentioned, if there was a measles outbreak or another vaccine preventable disease outbreak, these students would have to be excluded from school in order to protect their health and the health of their classmates. Additionally, Katie, you can go to the next slide. Additionally, students are left unprotected if they have that religious, personal, or medical exemption rate from school. And we can see that in Aurora, the exemption rates are very variable between the different schools. Depending on the school district, 0% to 33.4% of the student body might have an exemption for certain vaccines. So that leaves a wide portion of the Aurora community at risk and vulnerable to vaccine preventable diseases, despite having high overall vaccination rates. Depending on the vaccine, between 572 and 959 students in the school district have those exemptions. And you can see in the graph on the left that most of those exemptions are those personal belief exemptions, as opposed to religious or medical exemptions. Additionally, you can see that there are those large percentage of incomplete records. So those could be 2 areas of focus in the upcoming years to improve immunization rates and reduce vulnerability in Aurora, Colorado. Okay. So one thing that Immunize Colorado does to kind of increase those immunization rates both in Aurora and in the extended Denver metro area is our Shots for Tots and Teens clinics. Our Shots for Tots and Teens clinics are located in Aurora, Denver, Arvada, and Westminster this year. And they really strive to provide those free and low-cost immunizations to community members in need. They operate on Saturday mornings. We actually have 2 clinics coming up this Saturday in Westminster and Jefferson County. And these are a really great resource for families because they provide the vaccinations on the weekend and they try to reduce those financial and time barriers for families. Unfortunately, last spring, we did have to close down our Shots for Tots and Teens clinics for a little bit due to the COVID-19 pandemic. And one of my major projects has been working with our Shots for Tots and Teens clinic administrators to reopen and get started again this fall. So in order to do that, next slide, Katie. In order to do that, I worked with our administrators and created an on-demand training for hosting socially distanced vaccination clinics. This training can be found on our website and really goes through best practices and different potential models that you can use, like using a mobile clinic or creating a drive-through clinic to kind of enhance that social distancing and protect both the health of our patients and our staff at our clinics. Additionally, CDPHE created a playbook for holding offsite community vaccination clinics. So if you guys are ever looking for additional resources on vaccination clinics, I would recommend those 2 resources. Next slide. Additionally, Immunize Colorado gets a lot of requests from community members to hold and help facilitate vaccination clinics, either at their business, at their school, or other community center. Amy and I are currently working with New Legacy Charter School to organize a health fair for their students. New Legacy Charter School has a very unique patient population or student population in that they primarily serve pregnant and parenting teens and their young children. So we really wanted to collaborate with Stride Community Health Center to organize a health fair that would treat the whole holistic view of health for these students. Including offering vaccinations, including HPV, meningococcal, and influenza, but also offering dental health screenings, behavioral health screenings, and OBGYN services to really treat the whole health of the children at these schools. So next, I'll turn it over to Amy.
Great, thank you, Ellie. So hi, everyone. My name's Amy, and I'm the other AmeriCorps at Immunize Colorado. And my kind of area of focus is working with refugee and immigrant populations across Colorado. So one of the main projects we're working on now is a partnership with the Denver Health Lowry Clinic, and they're conducting patient outreach to refugees in their language of origin through telephone calls, and they're helping them schedule well-child checkups, immunizations, and they're really encouraging flu shots during this time. And this is kind of to address that drop-off in patients in the clinic because of COVID. Another one of my projects is conducting informational interviews with health coordinators at the refugee resettlement agencies in Colorado to better understand how we can support their programming, especially during COVID. And then Immunize Colorado also facilitates the Refugee and Immigrant Immunization Task Force. This has been around since 2016, and it consists of refugee healthcare providers, the state refugee healthcare coordinator, and school nurses, and really lots of stakeholders. And they kind of share best practices and challenges, and it's a really great collective learning space for everyone. Next slide, please. Great. And then COVID has really illustrated kind of the racial disparities and health burdens between racial groups. This is a fact sheet that Ellie put together, and it has some Colorado specific numbers. But then I also found this poll that's been cited quite a bit since it was first published in May 2020, but it really breaks down the differences and percentages of vaccine uptake between racial groups. So this means how likely are you to get a vaccine if it were to be available? So white Americans responded with a 56% rate that they would likely get the COVID-19 vaccine. And then 37% of Hispanics said that they would, and 25% of Black Americans said that they would. So this really illustrates kind of the differences in trust in the healthcare system across racial groups. And it really illustrates how the differences in outreach and approaches that need to be taken to reach these populations. Katie, can you go on to the next slide? Great. So out of all of this, we've kind of really been pushing to form an equity task force. And another kind of catalyst for this task force was we noticed a lot of targeted misinformation towards BIPOC communities in Colorado. And we've seen in the past how dangerous this really is and how it can lead to outbreaks within concentrated ethnic groups. So as this task force started their groups, and they They started meeting in September, but it's made up of patients, advocates, medical and public health professionals, policymakers, faith leaders, community-based organizations, and health equity advocacy groups. So it's a widespread of incredible people, and they really have a lot of group discussions and educational trainings, but they've also broken down into 3 different work groups, and that is communications, community engagement, and policy and advocacy. Next slide, Katie. So that kind of wraps up a lot of our programming, but we just wanted to extend some opportunities that we thought some of your organizations might be interested in and how we can help further. We mentioned some of the data that we work with. So that's school district and county level data. If anyone is interested in us sending that your way or providing additional resources, please let us know. And Ellie mentioned her Shots for Tots and Teens clinic. She has the dates and the flyers for all of those. So if you'd like to share those with your communities to point them towards existing clinics, that's a great resource. But also if you'd like to set up your own clinic within your community, like we spoke about the New Legacy Clinic, we're happy to step in and connect you with clinical partners and other resources. We've worked on kind of marketing materials and developing surveys and providing support on the day of. So we'd love to start a partnership with you if you're interested. And finally, if you would like to refer someone, that would be great for either the Refugee Task Force or the Vaccine Equity Task Force, feel free to connect them with us. Next slide. Thanks. So I think that wraps up our presentation. If anyone has any questions, feel free to shout those out.
Could you put your email back on the screen or the contact information, please?
Yes, will do. And I will definitely share the slides so those can be sent out to everyone as well.
Do people need to schedule an appointment for Shots for Tots and Teens, or can they just walk up?
So traditionally they operate on that walk-up schedule, but due to COVID, we've had to change it a little bit. Our Aurora clinic is an appointment only clinic. So we can also send out that flyer, which lists the number, but our other ones in Jefferson County and Denver are primarily appointment only, but they do have walk-up space if there is space available. So it depends on the clinic. We're all still kind of figuring it out and figuring out the best method, but we're happy to send around that flyer that gives a little bit more detail.
I hope that was enough time for you to grab that email address, but like I said, we'll definitely share the slides. But yeah, just encourage everyone to go get your flu shot if you haven't already. Really important this time of year, and just so much work being done around vaccine outreach and preparing for the COVID-19 vaccine.
Just want to thank you guys for your newsletter is so thorough and so full of perfectly accurate and timely information. So if people aren't signed up for that, definitely do so. Just props to you guys. Your newsletter rocks.
Thanks, Mandy.
Well, thanks. Oh, go ahead, Shay.
Oh, please.
Thanks, Katie, Ellie, and Amy for being here and sharing that great information with us. I think we will continue to share it out with partners and other folks. We've got about 8 minutes left, and so I wanted to see if anyone else on the call had announcements or updates or anything that they'd like to share. So I'll just open it up.
Yeah, if I may, this is Rich with the Aurora Health Alliance. If you all got the Aurora Health Alliance newsletter, you saw something I think is rather significant. In the past, people without Social Security numbers have not been able to get health insurance except possibly Kaiser. That's changing. The Division of Insurance now will permit people without Social Security numbers to get health insurance, and there are insurance companies that will accept that. Of course, the catch is they can't get it through the Affordable Care Act, Connect for Health Colorado, and there won't be a subsidy. But it's really as important for those who don't have social security numbers, because certainly in Aurora, if you're really, really sick with a specialty type of condition that primary care can't handle, you're kind of out of luck if you don't have a social security number and don't have health insurance. So this is, we're going to do more research on this. Certainly I will. As things roll out, we'll keep people updated on what this might really mean. And then the second thing is the Aurora Day of Giving is changing. That's where Aurora combined with lots of nonprofits to provide a day of food and resource distribution. In September, it was at Gateway. In this month, it was at Overland, and it was supposed to be on November 21st and December 19th at the mall, at the Aurora Mall. That's changing. Keep your eye out for your constituents and clients who have used that service. It will, in November, the distribution will be going to 7 food pantries, and the exact ones will be coming out. And then December, it'll be primarily hosted at the Aurora Salvation Army at Hoffman Heights in Aurora. So more details on that to come. So just want to make sure everybody knows about that. Don't rely that it's going to be at the Aurora Mall in this month and in December, because it won't be. That's all.
Thanks, Rich. Other community announcements for the group? I'll let people know. I know when I first joined this group, I had talked a little bit about Partners for Children's Mental Health building a virtual training site. And I'm really pleased to announce that that is live now on our webpage. And we are currently offering, we've just announced 3 new question, persuade, and refer on, live classes that will be held in the month of 2 in November and 1 in December. And you can register for those online. They're an hour and a half long, geared towards any adult working with youth and students who may be having thoughts of suicide. We also have our Utilizing Dialectical Behavioral Health Therapy series live now, and that is an on-demand course. It's a series of 5 sessions that mental health professionals can take on their own time. And so we can include the training link if you'd like to share that with your networks as far as suicide prevention and intervention strategies. They're all free. Any last thoughts from the group today or items to share before we move on with the rest of our day?
Well, thanks everyone for being here. Nice to see some of your faces. Our next meeting will be in February. Is that right, Mandy and Joe? February of 2021. So we will see you then. And if you have anything you'd like us to put on the agenda at that time, don't hesitate to reach out to Shai and I. We definitely love your feedback and would love to hear what would be useful to you. So stay healthy and we'll see you in 2021.
Thanks, everybody. Take care.
Thanks.
Thanks, everybody.